Welcome back to the place where the human mind is dissected with no mercy and every truth is stripped down to the bone. Here, nothing is exaggerated, nothing is softened, and nothing is safe. I'm about to walk you through a case, a disorder or a psychological phenomenon that most people are not supposed to hear about. If you choose to stay, listen carefully. Because the moment you understand how the mind malfunctions, you can never go back to seeing people the same way again. Let's begin. Capgras delusion is one of the most unsettling psychological syndromes ever documented. It is a condition where a person becomes absolutely convinced that someone close to them has been replaced by an identical impostor. The face looks right, the voice sounds right, the memories match, but the emotional recognition is gone. This presentation explains how this delusion forms, how the brain creates it, and why it leads to extreme behavioral changes that can destabilize entire families. Everything discussed here is taken from clinical literature, neurological findings, and psychiatric case documentation. Section 1. The core mechanism. Human recognition depends on two separate neural pathways working together. The first is the visual pathway. It identifies physical features, the structure of a face, the pattern of the eyes, the texture of the skin, and every micro difference that makes a face unique. The second is the emotional pathway. It creates the internal feeling of familiarity. It activates when you see a parent, a partner, or a friend you trust. This pathway does not process details, it processes meaning. In Capgras delusion, the visual pathway remains functional. The person can see correctly, they can describe the face accurately, they can confirm physical identity. The emotional pathway fails. It does not activate the sense of personal familiarity. It produces no recognition signal at all. When these two pathways disagree, the brain attempts to correct the contradiction, and the only explanation that makes sense to the patient is this: the person in front of them is not the real individual, they are a duplicate. This conclusion is not a metaphor. It is not exaggeration, it is literal belief. Section 2. Onset and first symptoms. Most cases begin after a neurological disruption. This can happen from head trauma, seizure activity, neurodegenerative illness, or a psychiatric break. The early symptoms usually appear subtly. The patient may say, "I feel like something is wrong with her. He doesn't seem like himself. This person looks like my wife, but something is off." At this stage, the patient is confused, not fully delusional. They're searching for a reason for the emotional disconnect. As the confusion intensifies, the delusion forms. And once formed, it becomes rigid. They begin stating, "This is not my wife. That is not my mother. They've been replaced." There is no hesitation in their voice, no doubt. No possibility that they might be mistaken. The delusion becomes the patient's new reality. Section 3. The emotional vacuum. A key feature of Capgras delusion is the emotional silence. The patient sees a familiar face without the feeling that should accompany it. Imagine recognizing your mother by sight, but feeling nothing internally, not comfort, not connection, not history. The absence of emotion is interpreted as danger. The brain signals this person should feel familiar. They don't, therefore, they are not who they claim to be. The result is fear, suspicion, and sometimes panic. This is not irrational fear. It is rational fear based on false neurological data. The brain is matching logic to broken input. Section 4. Behavioral changes. Once the imposter belief forms, the patient's behavior shifts dramatically. Common patterns include avoiding the duplicate, watching them closely, whispering that something is wrong, locking doors, seeking help from authorities, accusing the imposter of manipulation, refusing to eat food touched by them, asking where the real person went, becoming defensive or hostile in their presence. The patient is not being dramatic. They are not acting. They are responding exactly as anyone would if convinced a stranger was pretending to be a loved one. In severe cases, the patient may attempt to escape the home or call emergency services. Some believe the imposter is dangerous. Some believe the real person has been kidnapped. Some believe the imposter is studying them, observing them, or planning something harmful. These fears do not come from imagination. They come from misinterpreted neurological signals that the patient believes with complete certainty. Section 5. Family conflict. Family members often react by confronting the delusion directly. They say, "I am your husband. Look at me. I am your daughter. Why are you saying this? You know me. You recognize me." But confrontation almost always makes the delusion stronger. When the patient hears denial, they interpret it as deception. To them, the imposter is trying to maintain the disguise. The more the family insists, the more the patient feels manipulated. This creates a loop. The family pushes for rational clarity. The patient becomes more defensive. The family panics. The patient withdraws further. What they see is not a loved one acting confused. What they see is a stranger insisting that they are real. This dynamic is one of the most painful features of the disorder. It isolates the patient from the people they trust most. Section 6. Neurological evidence. Clinical imaging shows that Capgras delusion often involves frontal lobe dysfunction, temporal lobe damage, disrupted limbic projections, abnormal connectivity between visual and emotional centers, reduced autonomic response to familiar faces. Researchers discovered that when Capgras patients view familiar faces, their galvanic skin response stays flat. Their body does not react emotionally. There is no internal signal saying, "Yes, I know this person." The brain attempts to solve the mismatch by inventing a new reality. The person looks right but feels wrong, therefore they must be an imposter. This logic is consistent within the delusion. It is the brain trying to explain its own malfunction. Section 7. Associated conditions. Capgras delusion frequently appears in schizophrenia, Alzheimer's disease, Lewy body dementia, Parkinson's disease, post-traumatic brain injury, temporal lobe epilepsy, vascular dementia, psychotic depression. It can also occur temporarily during severe dissociation or after abrupt psychiatric breaks. In every case, the common factor is disrupted familiarity processing. Section 8. Risk factors. The delusion becomes dangerous when the patient believes the imposter intends harm. They think the real person has been replaced. They believe the imposter is studying them. They feel cornered. They are alone with the supposed imposter. They feel that escape is impossible. Some patients attempt self-defense, some run away from home. Some physically lash out due to survival instincts. It is essential to understand that these reactions come from perceived threat, not malice. The patient believes they are protecting themselves. Section 9. Clinical Management. Treatment focuses on stabilizing the patient, not confronting the delusion. Effective strategies include antipsychotic medication, mood stabilizers, cognitive behavioral therapy, reality anchoring techniques, environmental structuring, minimizing confrontational conversations, spending time with the patient in safe, neutral settings, regulating sensory overload, treating underlying neurological illness. The goal is not to force belief correction. It is to reduce fear by restoring emotional familiarity over time. In some cases, recognition returns gradually. In others, the delusion becomes chronic. Outcome depends on severity of the neurological damage. Section 10. The psychological implication. Capgras delusion reveals something uncomfortable about human relationships. We do not recognize people by appearance alone. We recognize them by the emotional response they trigger. Identity is not stored only in the visual cortex. It is stored in emotional memory. A person becomes familiar not because we see their face, but because our brain feels their presence. When that feeling disappears, the entire concept of relationship collapses. This disorder exposes how fragile familiarity truly is. It shows that even strong emotional bonds can be erased by a single neurological interruption. Section 11. Final summary. Capgras delusion is a catastrophic failure of emotional recognition. It convinces individuals that their loved ones have been replaced by exact duplicates. It creates fear, distrust, and dangerous misinterpretations. It is not a personality issue. It is not imagination. It is a neurological malfunction. The patient is not rejecting their loved ones. Their brain is rejecting emotional familiarity. And without that familiarity, no phase can ever feel real. You've just heard one more fragment of how unstable, unpredictable, and fragile the human mind really is. If this case or this disorder changed the way you look at people, that means you're finally seeing what most can't see. New files will be opened soon. More cases, more disorders, more cracks in the human psyche. Until then, stay observant, and if you want more cases, you know what to do. Remember, observation is survival.